Welcome. I am delighted to spend a little time with you this afternoon. I hope your morning was outstanding and you go home with at least one great idea that you're going to work on for yourself or your team or your organization or your patients. I'd like to spend a little time with you talking about collective effervescence. It's one of my favorite terms. It is a term coined by Emile Durkheim, a French sociologist, 100 years ago. And the beauty of it is, it's this energy and harmony and meaning that people experience when they come together with a shared purpose. And isn't that what work should be most every day? The energy and harmony and meaning and beauty of coming together with a shared purpose. And so that's part of our role as leaders, is to cultivate a spirit of collective effervescence and show you what it looks like. The reason we picked this for the cover of our book on ideal work with Tate Shanafelt, this is a teamwork by Bjorn Sjogren. And to me, it spoke to the energy and harmony of people excited about what they are doing together. And I'll share three more not quite so abstract images of collective effervescence. This is a group of 10 nurses in the Netherlands, in Amsterdam, who are professionals in one of the coolest organizations in healthcare in the world. They are totally self-governed. They have no manager over them looking at their day-to-day operations. They make all of their decisions along with, they're like 15,000 nurses in this community health organization. Each of the group of 10 is self-governed. They pick their own leader. All they have are these big level outcomes for patients and family members in the communities they work in. And they have off the charts extraordinary results for patients and families at extraordinarily low prices, and the practice in this model of Buurtzorg is being spread across the world and now to America. And to the collective effervescence, they have off the charts engagement and joy in work and camaraderie because of a number of factors, including the leadership model of self-governance. Here's another look at collective effervescence. This is a group of dedicated professionals at Mayo Clinic whose job is to sanitize sheets and sterilize endoscopes. They're among the lowest paid folks at Mayo Clinic, and they have off the charts levels of fulfillment and engagement and satisfaction with their work, in large part because of Mary Mulkel, the leader of this group that's in the basement of our largest hospital where there's no natural light. She has connected them as a group for this shared purpose of, in their own words, people are alive. That's on the whiteboard on the wall where you go into their work area. So that's another way that collective effervescence can manifest itself. Here's a group of 33 leaders from Jönköping region in Sweden, and it's at a different level than organizations. It's an example of collective effervescence where the shared purpose that these 33 leaders from this region of 1.5 million residents in Sweden, their mayors, their healthcare leaders, their transportation leaders, their education leaders, their park and rec leaders, most of them had never met each other, but together they said, we want to have everyone in our region feel welcome and respected and valued, and they've had an influx of a lot of refugees and immigrants, and now 21% of the population is foreign-born. So their collective effervescence stem from their vision statement, Tillsammans för alla liv för alla. We want the good life for everyone. And so that's what they've been working on for, I think, 5 years now. And even though 4 years ago almost none of them knew each other, now they're bound together in this camaraderie of collective effervescence of making a difference with this shared purpose that they have. So the essence of what we're getting at for organizational health is individuals and groups and organizations are much more resilient when we work together for a shared purpose, and we live longer. So I'd like to share with you 3 ideas that are evidence-based, they're validated, that you could consider in your leadership roles or somewhere in your organization for growing this camaraderie, this community spirit at work, for collective effervescence. So commensality, self-evaluation, and life crafting. So commensality is a fancy word for sharing a meal and a conversation with colleagues. I remember that old Italian toast, a tavola non si vecchia, at the table, no one gets old. And there's truth in that from a scientific standpoint. Commensality is a practice that firefighters commonly make meals together and share meals together, and it's where the first research on this was done. And now in healthcare, we have several high-quality randomized controlled trials with healthcare professionals that shows if you have a conversation and a meal. These are done at Mayo Clinic. Colin West and Cynthia Stonington, who you'll hear from later, were involved in these trials. They measured everything from professional burnout to engagement to fulfillment to cortisol levels to social isolation to positive feeling plus organization. Everything in these randomized controlled trials with real doctors and nurses and social workers and managers went in the right direction when they took time to have a conversation and share a meal with each other. So commensality has incredible number of benefits for organizations and people and patients, and the method of the force is collective effervescence, this shared meaning and purpose of comrades. Self-valuation is another important part of an ideal culture for the best possible patient and family care. You heard a little bit about it from Mickey Trockle, who's done some really important research in this area. So the culture of self-valuation has 2 elements. It has a learning element and has a self-care element. The learning element is when mistakes happen, when adverse events occur, when balls get dropped, when things don't go in an ideal way, people can either blame themselves and be shamed, or they can treat themselves like they would treat their colleague, which is to say, is to console them and work on fixing the system, the communication, whatever the root cause was. And the vast majority of the time when there are adverse events or anything that goes wrong, it has to do with things that are really out of the control of failable human beings. Their systems, communications, and handoff of the problem. So the ideal culture then is this just culture, fair and just culture, where when something happens, we look at, say, take a deep breath, make sure we take care of the patient and family, and then we say, what can we learn from this, instead of condemning ourselves, and so what can we learn from this? It's that growth mindset idea that Carol Dweck came up with. The second part of this self-evaluation culture, and Mickey talked about this morning, healthcare professionals are much less likely than the general population to take care of themselves. They're more likely to prioritize other work over their healthy diet, their meditation, their exercise, their time with family, whatever would be good for their own self-care. We in healthcare are much less likely to do that than the general population. So the ideal culture then includes features of self-valuation, where we're more likely to treat ourselves like we'd treat friends and colleagues who are involved in some mishap or shortcoming or mistake or whatever, and one where we prioritize our own health as much as we want our neighbors to, for our own good and our family's good and our comrades' good, and most important, we're better at caring for patients. And so the third piece of evidence-based ideas for growing collective effervescence is relates to something I learned from Chet Rehal. I was head of leadership development at Mayo at the last 10 years of my career there, and we would, and I was a chair before that, the CEO would sit down with the department chairs every Wednesday morning at 6:30 for an hour of discussion. And so one of the meetings, we just did a round table about ideas we had, and Chet Rehal was the chair of cardiology, and he was sharing how he works with staff on their development and coaching and mentoring. And he said that every time he met with a staff member, he asked them, "What brings you joy in work?" And some kind of rolled their eyes about, this is not supposed to be joyful, I'm supposed to be getting the work done. But eventually it all came around, whether you like the word joy or meaningful. We ended up studying that. Tate Shanafelt led this study where we looked at, we asked close to 500 physicians what was most meaningful to them at work. And if they were doing at least 20% of their time on what they self-declared as most meaningful to work, teaching, nursing students, doing research, taking care of diabetic patients who are from socially vulnerable neighborhoods, whatever it is that was most important to them, most meaningful to them, if they were spending at least 20% of their time doing that, they had half the rates of burnout. This whole research field is called job crafting. It's loaded with research showing the value of even a small amount of time dedicated to what is most meaningful to you. And I like to call it life crafting instead of job crafting, because it's something we should be looking at for our whole life. I keep a list for Hanford since 1996, a list of the top most important things in my life. It evolves over time, and then does my calendar match my priorities? And does the video match the audio? And this is the way to do that at work. And so you can job craft by changing your perception, and the perception would be like Iris Krauger. She's an environmental services professional. She doesn't look at her job as cleaning toilets and sanitizing doorknobs. We ask her, she said, my job is to save lives. She works in the colorectal surgery area, and she knows the risk of healthcare acquired infections, and she's reducing those. So her perception with whom you do your work makes a difference. And so you can't totally flip what you do at work, but sometimes you have a choice of doing this work with these group of people that are really inspiring to work with, and that can make a difference in your meaning, in your emotional exhaustion and your fulfillment. Or you can change your allocation of the time and do more of what's most meaningful to you. So in the last 3 minutes, I will just share with you. Last year, I had the privilege of leading a collaborative for the well-being group, and some of you I know were involved with it. We had 6 months where we looked at 2 interventions, listen, sort, empower, and 5 leadership behaviors that we know improve well-being, reduce burnout, and grow collective effervescence. There were 80 participants, 32 organizations. We did a mini Z survey before and after that measures burnout and fulfillment. It also measures collective effervescence. And so you look at these 4 questions that the leaders and the cohort responded to. There was a dramatic improvement in all of them, and they're basically feeling valued, feeling like you belong, feel like you thrive, and feel like you're making a meaningful difference. If you can get any combination of those for yourself or the colleagues you have the privilege of leading, you will succeed as a leader, and your staff will be joyful and more likely to give better care for patients and more likely to stay working with you because of the beauty of the harmony, beauty, and energy that one gets when you come together for the shared purpose of collective effervescence. Thank you.